So my presentation is on cisplatin. So first we're going to talk about the mechanism. So cisplatin is a chemotherapy drug used to treat lung, bladder, cervical, ovarian, head, neck, and testicular cancers. Its structure consists of a central platinum atom with 4 ligands, 2 aminos, and 2 chlorides in a square planar arrangement. The ligands are in a cis arrangement configuration, which is important for the drug's purpose, and the cisplatin is known to enter the cell via passive or facilitative diffusion and active transport. Once cisplatin has entered the cell, its main target is DNA. It affects DNA replication and repair to kill the cancer cells. So the way it affects DNA replication is when cisplatin enters the cell, it loses its chloride ions due to the low concentration of chlorine within the cell, and 2 water molecules bind bind in their place. However, they are loosely bonded, so they are replaced with nitrogens from guanine in the DNA. Now that cisplatin is now binded to the DNA, it causes kinks in the helix, making the DNA incapable to replicate, sending the cycle into arrest and to repair. So the way it affects DNA repair is that cisplatin, it forms a cisplatin DNA complex, which attracts the attention of high mobility group 1 and other repairing proteins, which become irreversibly bonded to the complex, resulting in a distortion to the shape of the DNA, making it incapable to repair and leads to cell death. So now I'm going to talk about the pathway. So the pathway proposed that, the pathway that cisplatin affects or interferes with would be P53. So P53 is a tumor suppressor protein encoded in humans by a TP53 gene. So P53 activates DNA repair proteins when the DNA has sustained damage. So it also induces growth arrest by holding the cell cycle at the G1S regulation point, or it initiates apoptosis if the DNA damage proves to be irreparable. So normally, the P53 is maintained at a low level during homeostasis by the regulator MDM2. So once it becomes active, the P53 will cause cell cycle arrest to allow either repair and survival of the cell or apoptosis, which is a cell death. So by stopping the cells with mutated or damaged DNA, the P53 helps prevent tumors, thus preventing cancer. But during cancer, which is the pathway when this occurs, that's when cisplatin is used. So during the cancer, the T53 gene is mutated, resulting in a mutated P53 protein. So the P53 is less capable to control the cell proliferation and unable to trigger apoptosis if the DNA is too severely damaged. So this results in an accumulation of damaged DNA in the cells, dividing uncontrollably, leading to tumor growth, which causes cancer. So now side effects. So cisplatin has, 2 types of side effects, which would be common or more severe. So the common side effects include nausea, diarrhea, hair loss, loss in the ability to taste food, hiccups, dry mouth, dark urine, dry skin, and dehydration. So the more severe side effects include toxicity, and one of the more common, types of toxicity seen in most patients is a nephrotoxicity. So the nephrotoxicity is toxicity in the kidneys. It's a poisonous effect that some substances cause on renal function. So the way it occurs with cisplatin is that cisplatin is transported to the renal epithelial cells, which causes kidney damage, which is pretty important because your kidneys are pretty important in the function. So it's a very important type of side effect to watch for. So because if you have too much of the cisplatin this occurs, it causes more regulated dosage. So you can't have too much cisplatin because this type of toxicity will occur. And as a question of mine is, how do oncologists keep the cisplatin from attacking normal non-cancerous cells? Because I did kind of come across in my research that it does tend to attack other cells. So I wanted to know how how they keep that from happening. And that's lastly is my references.